5 health issues that are connected to anxiety. Anxiety may be associated with an underlying health problem in some persons. Anxiety signs and symptoms are sometimes the first indications of a medical ailment. If your doctor feels that your anxiety is due to a medical condition, he or she may prescribe tests to look for warning signals. Medical issues associated with anxiety include coronary artery disease. Coronary artery disease, CAD, is the most frequent type of heart disease in the United States. It is also known as coronary heart disease or ischemic heart disease. A heart attack may be the initial indicator of CAD for some people. You and your healthcare team may be able to help minimize your risk of CAD. Shortness of breath, chest pain, and discomfort are basic indicators and common symptoms of anxiety. They are also symptoms of coronary artery disease. Coronary artery disease is caused by plaque buildup in the walls of the arteries that feed blood to the heart, called coronary arteries. Plaque is made up of cholesterol deposits. Plaque development causes the inside of the arteries to narrow over time. This is referred to as atherosclerosis. 2. Diabetes. According to researchers, anxiety affects approximately 40% of diabetics. This prevalence is substantially higher than that of the general U.S. population, where the illness affects 18.1% of people. Doctors will advise diabetic patients to monitor their blood sugar levels and engage in everyday habits such as paying close attention to food elements, avoiding certain foods, checking blood sugar levels throughout the day, insulin administration schedule. Planning, checking, and being prepared for a variety of problems are all essential for efficient diabetes control. However, some people may be too concerned about their blood sugar levels or the progression of their disease. This is most likely because hyperthyroidism causes stress hormones to go into overdrive, resulting in an elevated heart rate, tremors, and hyperactivity, all of which are indicators of worry. As a result, without the proper diagnostic testing, it's extremely easy to mix anxiety disorders and hyperthyroidism. While we cannot definitively assert that anxiety causes hyperthyroidism, anxiety and other mood disturbances are common signs of hyperthyroidism. Extreme physical stress, such as a heart attack, might trigger a thyroid storm in someone who has undiagnosed or untreated hyperthyroidism. 4. Chronic obstructive pulmonary disease, COPD. With symptoms like shortness of breath and difficulty breathing, it's simple to see why anxiety is widespread in chronic obstructive pulmonary disease, COPD, sufferers. Anxiety can cause feelings of nervousness and fear, as well as physical symptoms that interfere with daily life. Identifying, understanding, and controlling anxiety is critical for persons living with COPD, especially since the link between anxiety and COPD is related with more severe COPD symptoms, increased use of healthcare, more hospitalizations, and the need for therapy. Asthma. Asthma is commonly triggered by strong emotions and stress. There is evidence of a relationship between asthma, anxiety, and depression, albeit the results are not always consistent. Anxiety and despair may be linked to poor asthma control. Although there is evidence of a relationship between asthma, anxiety, and depression, the results are not always consistent.